Hi, my name is Tawny Dorr. I will be doing a PowerPoint presentation today on two common lung diseases, one known as COPD and the other one is cystic fibrosis. You can see on the right I have provided two examples of pictures on how these two lung diseases affect the lungs. What is COPD? COPD stands for chronic obstructive pulmonary disease, which is a progressive lung disease that makes it really hard to breathe. Smoking is responsible for 40% to 70% of those who are diagnosed with COPD, and it causes inflammatory response, cilia dysfunction, oxidative injury, other things like air pollution, indoor burning of fields, and exposure to dust and chemical agents can also cause COPD. And it usually affects ages of 40 years old and older. What is cystic fibrosis? Cystic fibrosis is also a lung disorder that is inherited and causes severe damage to the lungs, organs, and digestive system. This lung disorder directly affects the mucus-producing cells, digestive juices, and sweat. The fluids are usually thin and slippery. However, those with cystic fibrosis inherit a defective gene that causes these secretions to be sticky and thick. Instead of being like a lubricant, they plug up the tubes, the ducts, and the passageways in the lungs and the pancreas. The risk factors and the symptoms for COPD are air pollution, exposure, secondhand smoke, inhalation of chemicals, dust, or fumes, genetic alpha-1 deficiency, and a history of respiratory infections. The symptoms for COPD include frequent wheezing, coughing, extra phlegm and sputum, shortness of breath, and trouble taking in deep breaths. The risk factors for cystic fibrosis include those who have one or both parents as a carrier of the mutated CFTR gene or already has cystic fibrosis, a sibling or a half-sibling or a first cousin who also has CF as well. The symptoms of cystic fibrosis include salty tasting skin, persistent cough with phlegm, lung infections like pneumonia or bronchitis, wheezing and shortness of breath, poor growth or weight gain, frequent greasy stools or difficulty with bowel movement, and male infertility. The COPD laboratory and diagnostic findings include your healthcare provider will ask about your medical history. They will perform a physical exam and order breathing tests as well. Some of the questions that may be asked are, do you smoke? Do you have any long-term exposure to air pollutants? Do you have a history of COPD in your family? A physical examination will include listening to the lungs and the heart, checking your blood pressure and your pulse, examination of the nose and throat, and checking the feet and ankles for swelling. Testing that may be done includes a pulse oximetry to measure the oxygen in the blood, ABGs to check the oxygen and carbon dioxide levels, an ECG or an EKG to check your heart function, chest x-rays, or a CT scan to look for changes, and exercise testing to determine oxygen level in the blood drops during your exercise routine. The cystic fibrosis laboratory and diagnostic findings will include a newborn screening, which will be done on babies a few days after birth for a blood sample to test for the chemical called IRT made by the pancreas. A chloride sweat test will be done to test the amount of salt that's in the patient's sweat. Also, a carrier test can also be done on both parents to see if either one or both of them carry the mutated gene. Treatments for COPD will include the lifestyle change to quit smoking, to stop the ongoing damage, medications such as bronchodilators, which are inhalers that relax the muscles around the airways to help the relief of coughing and to help breathe easier. Inhaled steroids may also be prescribed, which will work to reduce the airway inflammation and prevent exacerbations. Oral steroids may be prescribed, which will prevent further worsening of the COPD. Antibiotics may also be prescribed for infections if there are any, as well as different lung therapies to help with the oxygen in the blood. The treatments for cystic fibrosis include medications that target gene mutations, antibiotics to treat and prevent the lung infections, anti-inflammatory to lessen swelling in the lungs, mucus thinning medications to help cough up the mucus, as well as inhalers to keep the airways open and relaxed for easier breathing, oral enzymes to help absorb the absorption of nutrients, stool softeners to prevent constipation, acid-reducing medications, and maybe even those for diabetes or liver disease when it's appropriate. To compare and contrast the two lung disorders, COPD and cystic fibrosis, the two of them have the following things in common. Neither of them have a cure. It's a lifelong disorder that can be maintained with the right medications. Both of them will progress over time, and those diagnosed are living a much longer and better life than before, as long as it's caught in time for treatment and to be maintained. The main organ that's affected in both of these disorders are the lungs, and both of them give trouble digesting and absorbing nutrients in the body. The difference between the two is that cystic fibrosis is diagnosed in your early life, and the COPD is diagnosed after the age of 40. Cystic fibrosis is a lung disorder that is inherited, and COPD is a combination of two obstructive lung disorders like chronic bronchitis and emphysema, whereas the cystic fibrosis is just one lung disorder that is inherited. Here are my references, and I hope you have enjoyed my presentation and learned something from it. Thank you, and have a good day.